I just wanted to say something that Kay sparked the thought when you said that you wanted to offer some informal observations about the security, about commodities in warehouses when your site visits. I will say that our evidence also supports that while there is some loss and waste in supply chains, that it was typically not due to corruption or theft. So there were certainly, I think, a lot of security measures that we saw employed around countries in terms of protecting commodities. But that was just one thing that we do have evidence to support what your observations are. In closing, I just want to say, we want to say, it has been a long road for both GAO and IOM to do this portfolio of work, and we really do appreciate the partnership that we had in PEPFAR and the USG implementing agencies, but as well as the country teams and the mission teams and the implementing partners that were always accommodating. We collectively spent a lot of time in countries while people still had to run programs, and not only were they very gracious and helped us in any way that they could, but we're also interested in seeing the results of the different studies and evaluations. And we constantly heard people saying, you know, how can we do this differently? How can we do this better? So we really thank everyone who participated in the course of our various studies, and thank them for their time and thank them for the work that they do. PEPFAR is a very heavy ship, but it still floats. And it's just absolutely amazing. And as Bridget, I just want to echo, is appreciating the complexity of the program, not only conceptually, but operationally, and all the different actors and stakeholders, and how well people are working in concert. Even though there are things that people can do differently to improve the program, it is amazing how well people are working in concert within various countries and across countries. So we thank GAO again for coming and having this dialogue with us and having an opportunity to be able to talk about our reports across the different topic areas. I think that we do agree and hope that Congress has found our collective work and respective work helpful in terms of authorization and reauthorization, as well as OGAC and the various agencies administratively. Hope that it is helpful in terms of making changes to the program and really maintaining the things that work well and offering some advice about things that might be changed. We certainly want to reiterate that we believe that there is a big discussion to be had, and the right direction is to go in terms of contribution and not attribution. And even with more players, everyone, I think, is going to have to figure out how to make that argument work for themselves, to be able to give credit across the board, but also to keep expanding the programs as needed and collecting the data to monitor and evaluate those programs accordingly. All of the committees, the committee felt very strongly, at least in terms of the IOM report, that we were not targeting authorization, and that all of the committee's recommendations are of equal weight or importance to the committee, and feel like that they should be implemented accordingly, but that they can be sufficiently implemented with the current legislation. We'd like to thank our staff for helping with this event. We started out, Todd says that they had a much smaller team. At one point we had a team of 10 to 12. We're now down to 5. So we'd like to thank Maggie Hawthorne and Kate Meck and Lee Carroll for organizing this event and helping out with this event today. We just want to mention 2 things that are forthcoming. We spent a long time not being able to talk about the report. Now we spent a good bit of time talking about the report, but we have some tidbits to leave you in terms of a little bit of a legacy that we think might be fun. It's a derivative product of the report. But the final publication will come out by the end of this month. The content is unchanged. We've just gone back and corrected any errors that we found. So they'll be available. It'll also be available online. But we also have something forthcoming. It's a web-based interactive experience. And we think that's going to launch before the end of June. Maggie's nodding her head back there, yes. And just to tell you a little bit about this, is that the goal is for the user to select different characters and experiences that will allow them to experience the complexity that people across the world face as they navigate the continuum of HIV-related services offered in PEPFAR-funded countries. And the user can see various ways in which individuals access services, as well as numerous barriers that they can encounter. And so the user will be presented with scenarios and decisions to make, as well as situations outside of the individual's control or random events. And these decisions, combined with these external factors, will influence the choices that become available to the user and the selected character's ultimate health outcome. So when it's available, we'll send another blast out for a digital launch, and hopefully you all can check that out and follow the experiences of some of these different characters that we have. I think we have 10 scenarios for you to experience. And so with that, we'd like to thank everybody for coming today, and thank everybody who participated via the webcast. And we look forward to, even though we don't have any more congressionally mandated work at this time, I think once you work on this for at least 3 years, you can't let go easily. So I think everybody is going to be keeping track. And again, thank you very much.